Dr. Michael Ryan with Missouri Vein Care answering the question, what is phlebitis and how is it treated? Phlebitis is the medical term for inflammation of the vein. And veins can be inflamed for different reasons. Probably the most common in the hospital setting is inflammation related to having an IV in a vein, an IV for fluids or medicine. And that causes the vein to close down, and there's a small clot inside the vein that causes irritation. One thing that people should understand is that blood itself is a natural stimulant to the inflammation system of the body, and it's very adaptive. It's normal. It's actually healing. And imagine you've injured yourself and you've got a cut or you've got a large bruise or swelling in your leg. The blood that's in that swelling is uncomfortable, and it begins to get more uncomfortable because it's actually triggering an inflammation reaction. The inflammation is designed to bring healing cells to that area. And one of the adaptations of all this discomfort is that you actually end up splinting or protecting the area of injury. So there is an adaptive response in this inflammation pathway. Uh, there's also fatigue associated with the blood clot that's in these veins. Usually, if you have a very small area of phlebitis, only a few inches or so, it's not enough to really cause a lot of inflammation in your body to the point where you would begin to feel fatigued. But if you have extensive phlebitis up and down your leg, and some people do, it can cause fatigue, and that can be very, disabling for people. More commonly, when people have phlebitis, the inflammation that's generated in response to this blood inside the blood vessel triggers the typical findings of inflammation. And these are present anywhere in the body you have inflammation. And it's redness, there's tenderness, there's heat. The heat is because the extra blood is flowing there. There is pain. And then in the medical terms, it's called functio liaise, which is the Latin for you don't want to use it. So that's the splinting, that's the protecting of that area of your body. So those are the typical findings of phlebitis. It's not typically dangerous except for a few scenarios. One scenario is if you've had a previous DVT and you develop phlebitis, you really should get another ultrasound scan. You may need to be on blood thinners. Another scenario that can be of concern with phlebitis is if you have phlebitis in a vein that's tracking along and extending, and it does tend to extend as the clot forms and begins to kind of slowly move. And typically you'll see every day it kind of moves up your leg. But if it goes into the deep veins, that can break off and form a DVT and a pulmonary embolism, which is a blood clot that goes to the lungs. That's very dangerous and serious. So the clues that that's happening is if the vein is closed off and has phlebitis in the thigh and is creeping up into the groin as it approaches the mid thigh, then you really should get in to see a physician, if not sooner, and get evaluated with an ultrasound. Those situations, it might be prudent in many cases to be on blood thinners temporarily while that stabilizes. The other area of the body is behind the knee, where veins in the calf track up into the deep vein right behind the knee, and they can extend in there and break off, and would benefit from blood thinners in that situation. So phlebitis is generally not dangerous. There's a few scenarios where you should be concerned about it, but in any case, if you're not sure, it's best to see your provider, let them decide if you need an ultrasound, and continue your activity. It's recommended most people should continue walking and moving. The reason being is that increased activity actually promotes the clot inside to dissolve. So that is something you don't want to lay around and do nothing, because that actually makes the clot get worse. So Dr. Michael Ryan answering the question, what is phlebitis and is it dangerous?